have probably heard of drugs like Ozempic and Wegovy, originally developed to treat type 2 diabetes, but new research suggests they might do more, from helping with weight to affecting inflammation, even brain health. Let's dive into the topic this morning and separate fact from hype. I'm joined with an expert, Dr. Brian Birch, an endocrinologist with University Hospitals. Dr. Birch, first, thank you so much for being with me.
Thank you for having me.
Yeah, so first, let's talk about GLP-1 drugs. You know, they're doing a lot more than controlling blood sugar and weight. What else are they helping in our bodies?
You know, these are incredible medicines. They've been complete game changers in the field of endocrinology and obesity here. They came out back in 2005, actually, and each iteration's gotten a little bit stronger. We definitely know about their benefits for weight and for diet. There's a lot of other things they do. We know that many of them lower the risk of cardiovascular disease. Some have been approved to be apnea. We use them in fatty liver disease, which is the biggest cause of cirrhosis and liver failure these days. They've also been shown to extend kidney function as well.
Wow, the exciting new research here on all of the things that these drugs are improving. You know, what do you think the broader impact is on public health as more and more folks kind of use these drugs?
Well, so many times when we see patients in the clinic, you know, obesity drives so many of these disorders. If we can help with weight, you know, things like diabetes, blood pressure, cholesterol, sleep apnea, fatty liver, heart disease get much easier to deal with. But we've also found some other interesting clues as well. We see that patients with chronic inflammatory issues, rheumatologic arthritis in many instances, they seem to experience less pain. We've seen some patients who suffer with addictions, substance addictions, have less desire to want to abuse these substances when on these medications. It's very exciting.
Wow. Okay, so if a person is on one of these long term, what do we know? Are there consequences to that? Kind of what happens too if you transition off of a GLP-1?
So, anecdotally speaking, we typically see when patients come off of these within about a year, the majority of people are gaining back the majority of their weight. If we think about how these medicines work, one of the most powerful things that they do is they signal the brain so you don't feel like you're hungry. What many have described as the food noise turns off. So you go out to eat and you're ready to finish your plate, and maybe the person's next to you and you're halfway through your meal and you're good. You don't feel sick. You don't feel bloated. You're just not hungry anymore. So I think the biggest thing is when we see patients come off these medicines is that all of a sudden that drive to eat is back and all they want to do is eat.
I see. Okay, so those are some of the long-term consequences too. If someone's watching this morning and they're considering a drug like this, what should they discuss with their doctor ahead of time?
I think it's very important when you start this medicine, you have a good discussion with your healthcare professional. When I interview patients and we consider using these medicines, I think about a couple of things. First of all, we want to make sure that there's no family history of syndromes. But most of the time, the side effects we see from these are GI side effects, things like bloated, pukey, nauseated, heartburny, maybe a little diarrhea, sometimes constipated. Now, the good news is when you start a low dose of this medicine and gradually increase it, the overwhelming majority of people do great. But I think it's important if you have a patient who has really uncontrolled heartburn, who has really bad constipation, maybe has a lot of GI issues, that you explore those and handle those before you start this. If you do this correctly, the majority of people are going to do just fine. If you ignore some of these warning signs, patients often have side effects in that setting.
Dr. Brian Birch, thank you so much for helping us kind of break this down, share more on this new research, and help folks at home with this. We so appreciate you.
Thank you.
Thank you. A lot of buzz around that topic. So good to learn the facts.